Today, we are covering pediatric infectious diseases, a topic the NCLEX loves to test through priority and precaution-based questions. The exam will not just ask you to identify a disease, but to know the immediate nursing action required. Let's start with differentiating the rashes. The test will describe a child with a fever and a rash, and you must know the difference between measles, also known as rubeola, and chickenpox, which is varicella. Measles presents with a maculopapular rash that begins on the face and spreads downward. The key diagnostic sign to look for in the question stem is Koplik spots, which are tiny white spots inside the mouth on the buccal mucosa. Chickenpox, on the other hand, presents as vesicles on an erythematous base, often described as a dewdrop on a rose petal. Critically, the chickenpox rash starts on the trunk and spreads outward, and the lesions appear in different stages of healing simultaneously. The most common exam question will require you to select the correct isolation precautions. A fantastic mnemonic to remember for airborne precautions is MTV is on the air. This stands for measles, tuberculosis, and varicella. These diseases require a negative pressure room and an N95 mask. Mumps and pertussis, or whooping cough, require droplet precautions. The exam will try to trick you by putting a patient with measles and a patient with pertussis in the same question and asking which requires an N95 mask. The answer is the measles patient. Mumps is another favorite topic, primarily because of its complications. The classic presentation is pertussis, or swelling of the salivary glands, giving a chipmunk-like appearance. The NCLEX will test your knowledge of complications like orchitis and pertussis, which is inflammation of the testicles, and the potential for meningitis, indicated by a stiff neck or headache. Your priority assessment should always include neurological status. Let's talk about a common exam trap, which is return to school or daycare teaching. This is a classic parent education question. For chickenpox, the child can return once all lesions have crusted over, not when the fever is gone. For pertussis, they can return after completing 5 days of antibiotic therapy. The exam will provide these as options, and you need to know the specific criteria. Finally, remember vaccine schedules and contraindications. The MMR and varicella vaccines are live vaccines. The #1 rule tested is that live vaccines are contraindicated in severely immunocompromised children or pregnant women. The NCLEX will present a scenario of a child with leukemia scheduled for vaccines and ask which one you would question. You must identify and hold the MMR or varicella vaccine. Never forget this critical safety point. It's a direct application of your nursing judgment.